Respiratory. Hi, my name is Amy and I'm a respiratory care student with the respiratory care department. And I read in your document that I need to draw an ABG, which is drawing from your artery. All right, before I begin, I just need to check your ID band. All right, perfect. All right, with this, I'm gonna be drawing it from your wrist, okay? This is gonna be a little more painful, but it's not gonna be bad. It's just gonna be a little sharp pinch, okay, going in there because it's gonna be from your arteries. So, and before I begin, I'm gonna make sure your vital signs are all okay before I begin the procedure. And if you have any concerns about jerking, moving, I can have somebody hold your arm because I need you to keep your arm extended and relaxed because I don't want you to jerk away. Because if you jerk away, I can accidentally poke you somewhere else or even poke myself, okay? All right, so before I take the actual blood, I need to do the modified Allen's test. So when the patient has their arm extended like this, I will set a towel or a tissue roll paper, something to go underneath to make the wrist extend a little more. And so I'm gonna hold the radial and ulnar arteries down, and I'm gonna have them do a fist 3 times, okay? Then I'm gonna have them hold out their hand. I'm gonna remove the ulnar artery, and I'm gonna make sure like the skin color comes back, and it needs to come back within 3 to 5 seconds. If that doesn't happen, then I need to do the other arm. Do the same thing, hold the radial and ulnar, and then I'm gonna need them to do the fist. And then when I have them open their hand, I need to make sure it comes back within 3 to 5 seconds. All right, before I do anything with the blood, I always need to make sure my hands are washed and clean. And then I'm gonna wear the proper gloves. And if I feel I need to, I can wear like goggles just to protect my eyes if for some reason the blood splashes up. So I'm gonna check their pulse and make sure I can find it again. Especially with gloves, it's a little different. And I'm gonna prepare all my necessary things. I'm gonna have my stopper, my alcohol prep wipe, the Band-Aid, and the gauze to stop the bleeding. And then I need to make sure I have their label made for their name, the patient's name, and their room number. And when I'm done, I need to write the time that I did the blood, and then I need to put the FiO2 if they are on oxygen, such as like a nasal cannula or even an air entrainment system. So before I begin, I need to do an alcohol rep wipe on where I'm going to do the area. I need to go in circular motion. That way I have a good clean area where I'm going to take the blood. And I'm going to then prepare my needle. I need to make sure needle's prepared. And sometimes you may need to do a little bit more blood just in case. So I'm going to get the cap off the needle. And when I hold the needle, I need to make sure I'm holding it like a pencil. Then I need to have the bevel up when I do it. So I'm going to palpate the pulse, and I'm going to make sure I find it. And then I'm going to go in at a 45-degree angle into the artery. And I'll notice the blood will start to go. And when I'm ready, I will place this and hold it on the patient. And it can take up to 15 minutes if they're on an anticoagulant. And I just need to make sure the blood is stopped. And for my needle, I can push it into the stopper here and dispose of the needle. So when I'm done, I can have it there. And then when the blood bleeding has stopped, I need to make sure I put a Band-Aid over it. And you need to recommend that they leave the Band-Aid on for a while just in case if it opens back up. All right, so once I am done, I need to make sure I put the stopper on here, and I can make sure there's no clotting, anything like that, no air bubbles in there. And then I'll put their label on the designated bag here, and I will place it in here, and I will send it off to the lab. And if I can't get it to the lab right away, I can put it on ice That way it doesn't start no clots begin or anything like that. And so I'm gonna dispose of anything and no blood is on anything, and I need to make sure like the needle is placed in the proper container system, the needle container system there. And so once I'm all finished with that, I need to reassess the patient and make sure they are feeling okay. And I'm gonna check their vital signs again, get the final set of vital signs before I leave. And then, okay, can I help you with anything else today? If they're okay, I will wash my hands again before I leave the room, and then I am done.